This is an extremely high-yield rheumatology review to increase your score on exam day. So let's begin. Pseudo-gout. In this condition, patients will have calcium pyrophosphate crystalline deposition within the joint space. This may manifest acutely following trauma, surgery, or extreme exertion. It most commonly affects the knee. To diagnose this condition, you need to do an arthrocentesis. This may show the presence of calcium pyrophosphate crystals and an increased concentration of leukocytes. Doing an arthrocentesis also rules out other conditions such as septic arthritis. Plain film X-rays may show chondrocalcinosis and degenerative joint changes. In order to treat these patients, you want to give them NSAIDs and colchicine. So since we just talked about pseudo-gout, now let's talk about gout. So gout is an inflammatory reaction to the precipitation of monosodium urate crystals within the joint space. It typically affects the first metatarsal phalangeal joint. To treat these patients, you want to give NSAIDs, colchicine, and or steroids for acute exacerbations. However, for chronic preventive management, this involves the use of xanthine oxidase inhibitors such as allopurinol. It's also important that patients with gout avoid triggering risk factors such as purine-rich meals and heavy alcohol consumption. As you can tell, for pseudogout and gout, there are different crystals that accumulate in the joint space. It also affects different joints, and the treatment is also different. So it's very high yield that you know the differences between pseudogout and gout. Ankle sprain. Twisted injuries of the ankle are common and more frequently result from inversion injuries to the lateral ankle. To diagnose an ankle sprain, the most important step in evaluation of ankle injuries is to determine if the patient requires imaging. To rule out a clinically significant fracture by applying the Ottawa ankle rules. So what are these Ottawa ankle rules? Well, first, you have an inability to bear weight immediately after injury and in the emergency department, or bone tenderness at the posterior edge of the tibia or fibula or tip of the medial or lateral malleolus. 3. Bone tenderness at the navicular or proximal base of the fifth metatarsal. If any one of these are present in the patient, then you want to go ahead and get some imaging done of the ankle. However, if it is negative, then you can use a soft protective brace and early range of motion exercises. Lateral ankle sprains of the anterior talofibular ligament are the most common encountered ankle sprains. This occurs when a plantar flex foot is inverted. Most patients with ankle sprains do not benefit from X-ray imaging. Ultrasound may be useful for assessing the integrity of a ligament. Most patients with ankle sprains improve with conservative management, including rest, application of ice, compression, and elevation of the affected joint. Polymyalgia rheumatica. Patients with this condition experience stiffness and aching of the proximal muscles and joints of the neck, shoulders, torso, and hips, especially in the morning. Systemic inflammation, such as fever, chills, malaise, fatigue, Increased CRP and ESR can also be seen. Increased risk of developing giant cell arteritis. So this is very important. When you're thinking about polymyalgia rheumatica, you have to think about the potential for developing GCA. These conditions often coexist. Patients should undergo a thorough examination to exclude the presence of GCA and be counseled on its symptoms. For example, headache, jaw claudication, temporal tenderness, and amaurosis fugax. To treat polymyalgia rheumatica, you can give oral corticosteroids such as prednisone, which is often required for a prolonged course, usually 1 or 2 years. Okay, now let's do some quick pharmacology review. Amitriptyline is a tricyclic antidepressant that is useful for the treatment of fibromyalgia. Cyclophosphamide is an alkylating agent that is useful for the management of severe cases of a variety of rheumatic conditions, including SLE, RA, and granulomatosis with polyangiitis. It has significant adverse effects, for example, hemorrhagic cystitis and myelosuppression. So basically, I just wanted to highlight 2 drugs that are used in rheumatologic conditions or chronic pain conditions, and also to highlight some of their adverse effects that can present on your exam as well. Falls in the elderly. Normal aging can lead to decreased muscle strength and balance, which can lead to frequent falls. Physical therapy is often used. Evaluate for other causes, for example, declining vision, cognitive impairment, medication adverse effects, polypharmacy, arthritis, and orthostatic hypotension, and the list goes on. So, of course, normal aging can lead to falls, but you can't just have an elderly patient come in and just say, oh, it's due to your age and not evaluate further. Look for other possible causes. You also need to evaluate events leading up to the fall. Like, did they have any chest pain, arrhythmias? Did they lose consciousness? Just find out what was going on leading up to the fall. The Get Up and Go test can help the physician risk stratify patients for their likelihood of falls. Carpal tunnel syndrome. In this condition, there is compression of the median nerve. Patients may experience pain, weakness, or paresthesia of the first 3 digits and have positive provocative test maneuvers such as the Tinel or Fallon tests. Mild symptoms are treated with wrist splinting. Wrist splints are typically worn at night but may also be used during the day. Splinting reduces the range of motion of the wrist and limits activities that increase pressure within the carpal tunnel. Patients who have persistent or severe symptoms or muscular weakness may require surgical decompression. Diabetic neuropathy. Patients with this condition often complain of a stocking glove distribution and gradual descent from the feet. To diagnose a diabetic neuropathy, a monofilament is applied with light pressure to 5 separate points on the plantar surface of the foot. Loss of the ability to detect one or more of these pressure points should prompt further evaluation and tighter glycemic control. To treat diabetic neuropathy, gabapentin is first line. Carbamazepine is also another option. If refractory to these drugs, you can use nortriptyline, a tricyclic antidepressant medication. Patients also need to do frequent foot examinations to detect any ulcers, cuts, or fungal growth that may predispose to a diabetic foot infection. Lateral epicondylitis. Patients with this condition experience pain in the lateral elbow with wrist extension. It's very important that you remember that because examiners like to just fit this word around to wrist flexion. So remember, lateral epicondylitis, pain in the lateral elbow with wrist extension. This is commonly seen in tennis elbow. Physical exam reveals tenderness over the lateral epicondyle and over the insertion of the extensor muscles of the wrist. To treat, we can implement activity modification and a compression sleeve or counterforce bracing apparatus. Very high yield. If you're enjoying this content so far, please be sure to power that like button, hit subscribe, and that notification bell so that you never miss another video like this.